Hello friends. So now we'll finish the rest of the topic that we have to discuss. We discussed already important drug name, that is the benzodiazepine group. We discussed barbiturate and some other drug that can be used in the as a sedative and hypnotic, that we'll discuss. So first discuss about the Z drug, that is a non-benzodiazepine, or we can say Z drug. It's not two, it's Z drug, and some other drug. So non-benzodiazepine means it's structurally the very different, absolutely different, but it's act on the benzodiazepine receptor in the CNS. That's why the name is non-benzodiazepine or J drug. But before the this discussion, I would like to share some information about the benzodiazepine. We forget to mention in last discussion about the antidote, about the specific antidote of the benzodiazepine group. So let's discuss antidote. Means if the person is take high much amount of the benzodiazepine, means the benzodiazepine poisoning, on the time we have a specific antidote. The name is antidote flumazenil. Flumazenil. This is the specific absolutely antagonist of the benzodiazepine. Means it's bind in benzodiazepine site on the neuron, that on the neuronal area, gate of the neuron, which is the chlorine entering inside the cell. So it's bind and completely inhibit. It means whenever you apply the flumazenil, it will bind and the chlorine cannot inside, because they completely inhibit the benzodiazepine site. And some other drug like bicoculin. Actually, this drug is the inhibit the benzodiazepine receptor. GABA receptor. And one also picrotoxin or picrotoxin. This is the inhibit the chlorine ion channel. Inhibit. So specific, this one is the specific antidote flumazenil that we can use during the barbiturate poisoning, benzodiazepine poisoning. And some other drug like bicuculin and the picrotoxin, instead of, we don't have, like on the time we don't have any options, on the time can be used. But main antidote is the flumazenil. And one thing also, that due to this reason we don't use barbiturate, like in if a difference between the barbiturate and benzodiazepine, because barbiturate we don't have any antidote, a specific antidote of the barbiturate, and we have flumazenil, specific antidote of the benzodiazepine. So that is the main reason also nowadays used to the benzodiazepine. So this is about some information that we must forget. Now we'll discuss about the Z drug, that is the non-benzodiazepine. So actually it's by the structurally it's different, but it act on the benzodiazepine receptor. So it's act only in alpha 1 subgroup. That we have 2 alpha and 2 beta. So it act on the alpha 1 subgroup. And it's hypnotic effect. Hypnotic effect can be seen, but very weak anticonvulsant and anxiolytic. As a hypnotic effect, you can see whenever you apply this drug. That's why most widely in insomnia we can use in insomnia. If you talk about the indication, so indication mostly as a hypnotic in insomnia. Insomnia, like it can be chronic insomnia, short term insomnia, or we can say transient insomnia. Means chronic insomnia, for example, the patient suffering from some other disease like COPD and some maybe cancer pain and some other pain. So on the time they can't able to sleep due to the pain and some other problem. On the time this drug can be help. And short term insomnia, it means like due to some deep emotions or due to some other problem like depression, on the time they can't able to sleep. So on the time this drug can be help. And transient insomnia means you are in sleep conditions but due to noisy or due to some other music and some other environmental factor are disturbing you. So on the time if you take this drug, it can be help for you or for the person who have this type of problem. So mainly indication is insomnia, but in other indications can be used like anticonvulsant, like it in a daytime sedative action can be. And I think this is the main indication. Pre-anesthetic medication can be used as a pre-anesthetic medication. Means before the surgery or before the applying a general anesthesia, so as a pre-anesthetic can be used. And during endoscopy, during endoscopy it can be used like cardiac catheterization on the time can be used. And along with the non-steroid anti-inflammatory drug like NSAID, so analgesic, so along with NSAID, non-steroid anti-inflammatory drug, this type use. But main indication, this is the insomnia, the any types of insomnia is best drug. Side effect can be it's a well tolerable drug. Side effect you can't see in a normal dose, but like lack of alertness can be seen. Metallic taste can be sometime. And psychological disturbance, but very rare if you increase the dose. And sometime like whenever you take the drug regularly in prolonged use, so in a morning like unpleasant mood, and so on, some other side effect, sometime like nausea type feeling and vomiting sometime. But it's depend upon the dose and depend upon the depend on the person. So this is the main we can say mostly effect that you can see to the person. So this is about the jet drug that we discussed already. Mechanism that it's not a structurally benzodiazepine, but it act on the benzodiazepine receptor, that is the alpha 1 subgroup. Its hypnotic effects, that's why it's used mainly in insomnia, types of insomnia. But in some conditions like anticonvulsant, pre-anesthetic medication, endoscopy, and along with the non-steroid anti-inflammatory drug can be given. Lack of alertness, metallic taste, psychological disturbance, and sometimes unpleasant mood can be seen as a side effect. So this is about the non-benzodiazepine. And some other drug also, like the melatonin agonist. As we know that melatonin, this is the hormone which produced from the pineal gland in the CNS. So melatonin is produced from the pineal gland, which maintains the circadian rhythm until the, or we can say in the underlying the sleep wake cycle. So about the melatonin. About the melatonin, as I said, that it's a hormone which is released or synthesized from the pineal gland, which maintain the circadian rhythm underlying the sleep-wake cycle. Means we can say in a very briefly that melatonin is a maintain our sleep cycle. So that's why antagonist means melatonin is not act any GABA receptor in any other neurotransmitter. It's just enhance or elevate the melatonin hormone that, and as we know that melatonin is maintain the sleep. That's why the patient can be or person can be well sleep if they have no any other problem, like just he have to sleep, he has to sleep due to some other problem, like due to noisy pollutions or due to some other environmental factor or due to some other emotions, little bit depression. So on the time melatonin can be help. So as an indication, it just increase the sleep time. Increase the sleep time. So during the insomnia, best drug, best indication is insomnia, and mostly this is for the short-term insomnia or transient insomnia. On those time, this is best drug because it's just little bit problem in the sleeping condition, so they can help. Hamilton and some other drug. About this drug, we will not discuss very deeply because this drug is not used as a hypnotic and sedative. About whenever we discuss antidepressant, we will discuss very deeply. Antihistamine will discuss very deeply. Now just you have to know that this types of drug can be used in some conditions. Whenever we don't have other, like we don't have any options of benzodiazepine and barbiturate and and this types of drug, on the time if you apply, so it can be helpful. So antidepressant we can use selective serotonin reuptake inhibitor and serotonin norepinephrine reuptake inhibitor. In this group, a lot of drug, but just you have to know that selective serotonin reuptake inhibitor and serotonin norepinephrine reuptake inhibitor, this can be effect like a hypnotic and anxiolytic. So in some conditions, like whenever maybe patient can't tolerate or patients have any hypersensitivity for the barbiturate and benzodiazepine or some jet drug or maybe melatonin antagonist, on the time this drug can be helpful. So about this drug we will discuss whenever we will discuss antidepressant. Now just you have to remember that the antidepressant group of the antidepressant drug can be help for the as a hypnotic, anxiolytic and anticonvulsant. Antihistamine, H1 blocker mostly. In H1 blocker, some drug like diphenhydramine, hydroxyzine, About this, also we will discuss. You have to just know that H1 blocker can also help as a hypnotic or sedative. Propranolol, we discussed already that propranolol is the beta 2 antagonist. It's non-selective beta 1 beta 2 blocker. Clonidine, it's a alpha 2 agonist drug. It's act on the alpha 2 agonist drug. This drug is best for the anxiolytic, but it's not drug of the choice for the anxiolytic. But in rare conditions, on the time don't have any options except this drug, can be used as an anxiolytic. So I think this information about the all as a hypnotic and sedative, we discuss everything, but one time I will repeat that the best drug of the choice nowadays as a hypnotic, anti-anxiety, sedative, and anti-convulsant for the benzodiazepine. This is the best drug, and except the benzodiazepine, other drug it's not drug of the choice, but in some conditions, maybe on the time the benzodiazepine drug is not available, or maybe some contraindications, some allergy, so on the time can be used, but main drug of the choice is a benzodiazepine. So I think hope you will understand and you will like our discussion. Thank you so much. In our next session we will discuss anti-Parkinson's drug. So very soon we will discuss. Thank you so much.